My name is Emily Sellis, and I'm your host for the Sage Holistic Show. Today, we are so excited to hear from one of the holistic healers of Orange County, Dr. James Morgan. He is going to share with us some very important and relevant information about when medication might be necessary. Have a listen.
Sage is a 501c3 nonprofit organization building community by providing education and counseling about physical, mental, and spiritual well-being. We encourage all of our listeners to find their own path to what holistic wellness means to you. James is the owner of Anchored Psychiatric Nursing Services, and he is a psychiatric nurse practitioner who really works with an excellent holistic lens. And I just have, the way that I met James was because I was working with him with a mutual client, and the consultations that he and I would have together, I was just so impressed by him and his care for his clients. And then also how he was really, it wasn't about trying to get them on a lot of medication, which we hear happens a lot. It was about how to balance that, how to give them the medications that worked the best for them for their metabolic rates and how it affected their body with the side effects, and just keep them on the least amount of medication. So this was like meant to be a connection, and he's actually like down the hall. He can probably hear my loud voice talking right now. So he's in our office space here at Sage, and we're so grateful for that shared connection. And so James, I'm going to turn the time over to you.
That's all I need. Thank you, everybody. I'm actually going to share my screen. I'm kind of a PowerPoint guy. That way I can stay on task without, I'm an analogy guy, and I'll talk forever, and then we'll be out of time. Thank you, Emily, for that. Again, my name is Dr. James Morgan. I am a doctorally prepared nurse practitioner, dual certified in adult gero acute care. So that's the inpatient, the medical side of things. And then psychiatric mental health, which is, of course, the mental health side. So looking at both sides of that. One question sometimes I get is like, what is a nurse practitioner? And, and you can prescribe, can you diagnose? So really what it comes down to is a nurse practitioner comes from both the medical model and then the nursing model. So for those that were in the previous breakout rooms, I apologize for the repeat on this, but basically I care about kind of the whole person. I guess that's really the holistic side of things, but really that's where the nursing part comes in. So not only do I care about your current symptoms, what brings you in, but I'm also curious about your sleep, your nutrition, your bowel habits. The looks that I get on people's faces when I ask about their bowel habits, sometimes they kind of, oh, golly, what the heck am I didn't realize I was here for that. But really, because it's looking at the whole person. So really where I come in and why I decided to open up my own practice is because I saw a lot of gaps in the mental health field of things. The amount of time that we are able, or that we're typically allotted to patients, so patient client term used interchangeably with myself, is that really it came down to, what are you here for? Let's get a little bit of the history, and then let's talk about medications. Whereas I wanted to spend a little bit more time, a lot more time really, with my patients or my clients, really to kind of get a real good feeling of what are they here for. Sometimes, they're there because they're seeking treatment, or they come to see me because my spouse said I need to come talk to you, or my therapist says I need to come talk to you. And then also at the same time, kind of getting an idea of what is their thought process on medications. Because ideally, that's really what it comes down to in terms of what I kind of bring to the table. So big elephant in the room, I make a living off of prescribing, among other things. However, I'll be the first to tell anybody that you're going to get more out of therapy than you will medications alone. So when it comes to why do they come to see me, I want to know what their why is. Are they having certain overwhelming feelings or emotions that are impacting their day-to-day life? And what are we going to do about it? So again, like I said, before we go deep into medication pharmacology or anything like that. I really want to make sure that my clients and my patients understand that there is a stark difference between what is situational and environmental, and then what is pathophysiological. So that is where it comes into kind of my wheelhouse of being able to delineate the two. So sometimes right from the beginning, as patients kind of go into their story, into their why, obviously the wheels start to turn in terms of, well, what would be a good approach. So for example, in terms of why sometimes I might turn somebody away by the end of the intake of saying, you know, maybe medications aren't for you, is quick stories I can give you is one, grief. Sometimes people come in here and it's just a grief, you know, they lost a loved one and they're having a hard time with that. First question right off the bat is, are you talking to anybody? Are you talking to a grief counselor? To be able to kind of work through the process accordingly. And sometimes it's no, where it's like, let's start there. And then if we're having trouble with processing, then that's where you can come back and see me. Another one is I had a gentleman that came in here and he said, you know, my wife told me that I need to come see you. So why is that? She says that I must be bipolar. Must be. Okay, please tell me more. And the more we got into it, it came down to he's not an active listener. He's hearing what he wants to hear. And I said, well, no medication's going to help with that, my friend. So gentleman ended up not being bipolar. It's just one of those things that he had marital issues that he started to kind of do this stuff when it comes to some of the issues that were coming up from his wife. So it's important that there's definitely a delineation there between what is situational and what is pathophysiological. So what's my why? If someone comes in and they're having symptoms that seem to be more than just situational issues, that's not related to a medical issue, maybe even hindering their progress in therapy, then that's when we might want to consider potential for medications and or supplementation. So it's a real interesting triangle really between clinical expertise, current evidence-based practice, and research, because that's really what it comes down to treatment. And it's important to look at what is clinical evidence-based practice and research put in together. And that's kind of where the doctoral research comes into play. You know, there's a reason why we're not using metal bedpans anymore. A lot of research behind it, but hey, that's how we evolved. But then at the same time, bringing in the client and the patient's values. If they're really, really concerned about medications. So usually there's one of three situations that come to play in terms of when I'm starting to assess what their thought process is on medications. One, it might be a numb me up. I don't want to feel anymore. Then that's where we got to start working through that, where it's like, well, one, I'm probably not the best provider for you, but two, there's going to be no progress with something like that. We'll have the other side of where it's like, I don't want medications. It's big pharma. I'm so concerned about side effects. I don't want to be addicted or hooked on them. And then sometimes we'll have people in the middle saying, I've tried some different things, but I'm open to suggestion. So it's important that kind of getting that assessed in terms of where their mindset is. And then that's how we can show where there's evidence to show that you can have better outcomes potentially with both medications and therapy in combination. So at the same time, part of the initial intake is looking at both what are their symptoms and then bringing in as much science as we can, because this, believe it or not, is a very subjective field versus an objective component from the medical side of things. So for example, in cardiology, we know that the impulses go from the SA node to the AV node and so forth. And if we can get an EKG, and for those that are maybe not familiar with an EKG, it's the big squiggly lines that we connect you to figure out, okay, well, where's the impulses coming from in terms of the heart. And if there's an issue with something, then we'll know objectively where in the heart there's an issue with. Or if I give a beta blocker for blood pressure, well, I know that it's going to lower the blood pressure and the heart rate. Whereas in coming into the mental health side of things, it's so subjective. I can't draw a neurotransmitter blood test. So it's important to look at the whole person. Again, looking at medical history, looking at their mental health history, whether it be diagnosed or not. Looking at family history, what medications they've taken, including supplementation, previous symptoms that they may have had prior to coming in and chatting with me. And then once again, what is their current symptoms? And then we try our best to relate those to the neurotransmitters. So I won't go into the whole sciencey talk to you unless you're all interested in having an extra hour and a half. I'll bring up another PowerPoint and you can get a good nap into that. But basically, there's so many different neurotransmitters. So a lot of times when people say, "Oh, I have a chemical imbalance," one, it's a neurotransmitter, not a chemical. But now I'm off my soapbox with that. But the big players really comes from serotonin, norepinephrine, dopamine, GABA, blah 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 blah, a bunch of other ones too. So serotonin in itself, that's our happy neurotransmitter. Typically, if we don't have enough, we're kind of sad, depressed, down in the dumps type of feel. Norepinephrine, if we think norepinephrine, epinephrine, and adrenaline, it's all the same family. So that helps with focus, motivation, energy. If that's kind of running through the roof, typically we're going to have this sense of underlying anxiety. Because again, we want all these things to kind of ebb and flow based off the situations and the environments that we might be in. And then dopamine's like our pleasure sensation. We do something we get pleasure out of. So that helps with a lot of the emotional aspect of things, some attention, and how we learn. So again, those are kind of the big three big key players. Of course, again, there's other ones that help with memory and concentration. Now, we have to then determine which medication we're going to use for individualized care. And now when I say medications, we can also, part of the conversation I have too is other supplements that we could potentially use. So if we know that with anxiety, a lot of times we're going to bring in serotonin. Serotonin is kind of like the big component that we want to look into. So for example, and one thing is I really focus more in on symptoms versus a true, what is the diagnosis? Some people want to come in and say, well, what's my diagnosis? I got to know what my diagnosis is. Well, I mean, it's important, of course, from the treatment approach, obviously for being able to prescribe so that it's covered by insurance and what have you. But is my treatment approach going to change based on a diagnosis? Potentially. Of course, if say someone comes in and they're going through a psychotic process, well, that's going to definitely change my treatment approach versus say I have depression or anxiety or trouble with focus. So for example, if we know that anxiety in itself is more related to norepinephrine, well, baseline first-line treatment sometimes for just anxiety in itself is actually an SSRI antidepressant. And the thought process with that, if we know that our norepinephrine's up here, our serotonin's pretty good, but let's bring up our serotonin just a little bit, let's kind of quiet down some of that norepinephrine, then that then helps both with the depression anxiety component of things. So the big part here though is we want to make sure that it's individualized care. So then going into the supplementation thing, if we know that, hey, serotonin is kind of what we want to attack here, well, let's look at maybe some serotonin supplements as well. So again, just meeting the patient, the client where they're at. So really, again, my practice philosophy is medication management along with a therapeutic modality typically will have better outcomes. So on my consent, in terms of what this is the initial treatment consent of what we're going to start with, it's either continue therapy or seek therapy, and then giving the appropriate resources out for that. So at the same time, if medications aren't for this individual, we're not going to prescribe it. We're not even going to recommend it. At the same time, I'm also a big component on, hey, if you don't have to make a decision right now, at least here's the information, here's my clinical expertise on what we think. Now, the bummer about a lot of these medications is it takes time. Unfortunately, we haven't come up with like the magic pill yet. If we do, I'm sure we'll be touring nationwide with it. But until then, it's bringing in that subjectivity, trying to bring in the objectivity of rating scales and history and bringing all that into it. And then at the same time, maybe looking at labs. It's important that we don't go down this rabbit hole of psychotropic medications if it's maybe their thyroid that might be off a little bit. So it's important that we look again at the whole person. So medications aren't always prescribed right at the beginning. So let's, obviously let's get some therapy, maybe let's look at some blood work, and obviously looking at nutrition, sleep, and other behavioral aspects of things. So it's important that we strive to inform our clients and our patients as best as we can. Don't want to overload them with information, but at least they can come in with an informed decision so they can make the best decision for them, because there are always options. If anyone ever, sometimes people come in with previous experiences with healthcare providers saying, you have to take this medication. This is the only thing that's going to help you. Well, that's not always the case, unless you've literally been on every other medication that's out there or every other supplementation that's out there. There's always going to be options. So it's important that we talk about, one, what are the options? What are our anticipated benefits? Because we want to use medications, supplementation, as a tool. It's not a cure. It's a tool in the toolbox that maybe their toolbox right now might be filled with poor self-worth or self-doubt, self-talk, suicidal ideation, self-harm, insert any poor coping mechanism. So now we have this toolbox that we need to start taking these tools out, and through therapy, start putting in good coping skills and strategies. And in the interim, maybe we need to insert a medication because we're not able to progress through therapy, or we're starting to hit that, maybe that trauma start that I have a really tough time even to be able to process, because we don't want to waste our time in therapy. It's a lot of stuff. It takes a lot of mental effort to be able to be true to oneself. And sometimes if we want to look at the anticipated benefits, is just to take the edge off a little bit. Or if anxiety is our problem, that we don't get so anxious, or if depression's our issue, that we don't get so depressed that we want to harm ourselves. I usually like to use the term, like to stay even, but that might even maybe not be the best way to say it, because it even means like we're always here. The idea is we still want you to feel, still want you to still have your creative outlet if that's their personality. We still want you to feel like a human being. Ideally, if you're having a good day, we want you to feel like you're having a good day. If you're having a bad day, we want you to feel like you're having a bad day, but that's where therapy comes into play. So eventually, if it's appropriate for the individualized care, that once you kind of get to a point in therapy where we're really not talking about a whole lot, we still want to continue with therapy, but that's typically where I say, let's start looking at, if we can, to start lowering, to maybe even try to come off of the medication. Because again, we've maybe can change that tool out of medication and then put in those coping skills and strategies. And then really that's where we can kind of put those things to the test. So it's always worth the conversation. And that's kind of my main philosophy, is that let's talk, ask as many questions as we need. We want to make sure that we have a good learning environment, open form of communication, because really we need to be their advocate to their healthcare. I do take a collaborative approach. So especially if they're coming in as a referral from a therapist, or if I say, hey, we need to get a therapist, or they have a cardiologist, neurologist, whoever, it's important that at least we know that we're all part of the team. So one analogy that I like to give to the clients is like, hey, you are the star of the show. We are all just the supporting cast. And it's important that with that, we are all there to look out for their best interest. So that way they can make an informed decision about their healthcare and just know that we're part of their team. So that is it from the official presentation. And we'll open it up for questions.
Thank you, James. Yeah, let's do some Q&A, you guys. We have James right here in front of us. Professional.
James, I'm going to start using that. You are the star, we are the supporting cast. I got to use that.
Agreed. I
really,
do that really well too.
Thank you. It really gives them that sense of like we're here to support you. You're not here to put food on my table, because it's important that some of the questions or the concerns that I get is like, of course you're going to talk about medications because that's what you do for a living. So it's important that they know that there's always options and that we're here as a team to help them.
I also wanted to say to you, James, something that really, that just really landed for me even when you were talking about, if someone's having a psychotic process, like just your language in that, oh my gosh, that really landed for me, because I'm so used to hearing such the clinical, like the psychotic break, and it feels so stigmatizing. And you just soften that in a way that it was just, we already know I send you referrals, but I'm like, oh, that makes me feel so good. Like, I know that my clients, when I'm sending them to you, are in such tender, capable, smart, but like loving hands. So that really landed for me. So thank you.
Thank you.
James, I have a question for you. Oh, did I impede?
Hi.
Go ahead.
Oh, okay. So being that you are so pro, coupling therapy with medication, and you're such a big supporter in that, as a therapist who sees clients with who have psychiatrists or even like yourself, what do you recommend when we talk about treatment team? Would you recommend that therapists that therapists, if given the opportunity by their client, talk to their psychiatrist? Do you think it's important? Do you think there's value in that? For myself, I've never had to do that. I didn't feel like there was a need, but I'm wondering on your perspective, if you think if that would be important, just an important aspect for the psychiatrist and therapist to interact, again, if that was okay with the client. Just wondering what your feedback is on that.
Absolutely, because again, taking that team approach, and even if it means like, hey, just so you know, I'm part of the team, then that's just established that we have that open line of communication, given the patients or the clients consent for that. I find that it's important because they're spending more time with therapy.
Mm-hmm.
They're going to see me once a month. Maybe obviously we can adjust as needed, but usually it's in the beginning, it's every, maybe I'll see you again in 2 weeks after our initial intake, or hey, just make sure you reach out to me, shoot me an email or call me. But I do find that there's a big benefit there, because especially if it's a referral, since you're spending more time with them, you'll be able to kind of notice some of the subtle nuances with something's coming up here. Or at the same time, there's a little bit of a breakthrough there where, again, remembering what our expectations are of medications, even if it just means, they're not so anxious during our session, then you can even be able to mention that to the client. Or at the same time, if there's a communication thing where sometimes, believe it or not, patients might come in and they'll lie. I think everything's good.
Mm-hmm.
Oh, really? Whereas maybe in therapy, they're talking about how terrible things are going. You know what? I decided I'm not taking the medications. Or they come up with these different things that, because look, there is a stigma to it, or maybe they don't feel super comfortable with their prescriber, that it's important that you can come in and say, hey, they may not mention this, or maybe let me give you some information on, they were really talking about their binge drinking lately. Maybe they haven't really brought that up to you yet, because they come in very functioning and they present themselves in such a way that allows myself as a prescriber, which knowing, hey, medications and illicit drugs and alcohol don't normally mix very well together, that I can bring it up in such a way that it's more from an assessment aspect and from a safety part versus a punitive, wagging my finger at them. So I do find that it's important that because you will know them in such a deeper way that there's at least a good collaborative approach there. Long way of me saying yes.
Hi, James. I was just going to piggyback on Robin a little bit and fangirl for a minute, and like how thankful I am for your approach and your services. The clients that I've referred and the partners of clients I've referred have just had, I mean, in my 10 years as a therapist, a completely different experience with a prescriber than anyone else I've ever heard of. So I'm so grateful to you. Thank you for that. And then in addition to that, I recognize you're one person and have all of us kind of now like, oh, thank goodness for James Morgan. And I'm like, if you were ever in any kind of group or you knew any other psychiatrists that you felt really embodied the same kind of practice philosophy that you do, and that more holistic and gentle and also like listening to the client approach. I would love to hear if you had anyone else that you also recommended. I'm in South County, and so sometimes it's a little hard for my clients to go up to more of North County. So thank you.
Yeah, thank you. And I'm trying to do is, one, I'm planning for growth, that eventually we can kind of make this kind of a more of a one-stop shop in a way, but by adding more providers that have the same mentality, but that's down the line. There's so I'm trying to right now trying to build a referral list of those that kind of are like-minded. There's one in particular that she's actually in Oceanside though. So obviously that would be more of a telehealth component to things. That does have that is also open to the collaborative approach. Some of the other ones that I do find that have that are like-minded in that respect, they also work in a practice that their follow-ups aren't, they're limited to a short amount of time, that I think then would give the wrong impression, especially with you saying, hey, go talk to this guy or gal, that they're limited to the amount of time, or whether maybe even their follow-ups are good, but they don't have the communication ability based on how the practice is set up. So, but I will, as this list does grow, then that's something it's on my to-do list to be able to share, because it's again, it's not so much like a hey, I need everybody because of that part. I think it's more about what resources can we all have for patient-centered care. So thank you very much for that, Melissa.
Time for one more question. Does anyone else have a question?
Yeah, James, I really appreciate you mentioning underlying medical conditions. How often do you find that somebody does that maybe they don't need a psychiatric medication, but maybe they have a thyroid issue or a testosterone issue? And do you do blood panels, and would you refer to like an endocrinologist, or how does that work?
So depending upon their initial symptoms, because there's two things I have to look at. One, if they're coming to me uninsured, that I do talk to them about labs, and I'm working on actually within the next couple of weeks, I'm going to have a phone call with a local lab that might be able to do more inexpensive panels versus the big players of Quest and LabCorp, for example. But at the same time, looking at maybe what type of insurance that they have, because I have to be able to, one, justify the need for it, because there's a lot of times to look at, oh, this is coming from a mental health side. Why are we going to look at some of these panels? Or, hey, when was the last time you had this done? I actually had to write a little dissertation for a Medicare client because they denied payment, or they were asking for payment on a couple of vitamin panels for a client that I had to get my up-to-date research and be able to cite appropriately in APA format that of why this would be necessary. So it's kind of sometimes a give and take with it. So I usually have my basic panels that are typically approved, And right from the get-go, hey, when was the last time you had blood work done? And if they've had it done within, last month or two, then that's typically, okay, great. Can you bring me a copy of it so I don't have to poke you again? But if it's one of those, I haven't had it done in a year or a long time, or even if it means that, hey, I've never had, or I've had blood work done and nothing's ever popped from it. It's like, how long have you been having your symptoms? And then trying to correlate it with that. So that's something I can give them a generic lab form that they can go wherever, whatever lab that their insurance would take, or an out-of-pocket perspective. And I'd say more times than not, usually everything's pretty good. Now, the occasional, hey, the thyroid's off, or hey, your vitamin B12 is down, or your vitamin D is down, folate, for example, that, okay, can we bring that into some of the nutritional aspect of things? And then, that's kind of a small area of mine. So then I would refer out to our nutritional practitioners for more in-depth components to that. But occasionally you'll find that, hey, the thyroid's off, or your sodium is, if any of my elderly clients, the sodium could be off by just a tick, and that gives them the sense of confusion, and that's where, you must be mental. You got to go see a psychiatrist or a mental health practitioner. So then it's like, well, no, it's then the medical side. So in terms of, and one thing that I teach my students is, well, if anything that you order, and let's say something comes back from it, you got to be able to do something about it. And whether that means, hey, let's work on the nutritional aspect of things, or hey, this, did you know that you might be diabetic? Then we go, depending on their insurance, do you need to go to your primary, or do we need to go to endocrinology, or any other type of specialty? So I find that there's a lot of value in it to either rule something out, or to say, hey, let's look at this first before we start going down the mental health side.
Thank you for spending some of your time today with us at Sage Holistic Health and Wellness Center. If you like what we're all about, please consider supporting our nonprofit organization by making a tax-deductible donation. To do this, you can go to our website at www.sagewellnessctr.org and click on Donate in the upper right-hand corner. We look forward to spending some time again with you real soon. Take good care.